Hi, I'm Dana Sterling, founder of Sterling Structural Therapy, a fascia-based virtual chronic pain treatment. And the question I would like to very briefly answer is, are our emotions stored into our fascia? And the brief and short of it is no, okay? So there have been a few research studies that I have found that have shown correlation between people who are dealing with anxiety and depression have higher tension levels in their fascia. And that, were very well designed studies actually, and that is absolutely valid. Taking some pieces of research like that and making the statement that fascia stores our emotions is reprehensible. So first of all, correlation is not causation, but this is frankly a case of pretty wild speculation. So if someone tells you that as they're doing fascial release of any sort of fascial therapy on you, they're going to help you resolve your childhood trauma, don't walk away from them, run away from them. Now, I'm not saying that as someone gets treated for chronic pain conditions, I've been working with chronic pain conditions for over 25 years. I am not saying that that may cause some emotional responses. Of course it is. You are a human being. And that's a cat. Human beings have emotions. But saying that if you roll your IT ban, you can release your PTSD from a car accident or some childhood trauma, it's just wild and out there. And what worries me is more, if you really are dealing with a really considerable trauma that you need to process through, very high chances that whoever is trained in myofascial release or rehabilitation is not properly trained to treat you mentally and emotionally. So unfortunately, why am I doing this video? To protect people, because the most vulnerable populations sometimes end up in the line of fire. Please don't misunderstand. I don't think anyone stating that is intentionally trying to take advantage or harm someone. But please, let's become more educated about this. So no, fascial release is not the equivalent of doing behavioral cognitive therapy or EMDR or many other modalities that are extremely helpful and proven and safe methods to deal with real traumas.